Hi, my name is Cheryl Sarnes, and this is my course project for ANIM205 Animal Nutrition. Presentation to a client guiding pets to optimal nutritional health as an animal nutritionist. In this presentation, we're going to talk about animal scenarios, digestive system, the structure and function, nutritional requirements, common dietary requirements. I will talk about a couple of studies that I checked out and 3 different diets that I researched. Body conditioning score, daily energy requirements, recommended caloric intake. The animal scenario I chose was Toby, a 12-year-old domestic short hair, male neutered cat weighing 12 pounds with a BCS of 5 out of 9. He has health concerns, a history of urinary problems, with a recent urinalysis revealed tiny crystals, suggesting potential future concerns with urinary stones, uroliths, and blockages, urethrals, obstructions. The objective is to find the owners a dietary recommendation that will aid in preventing future urinary issues. A brief review of the feline digestive system structure and a diagram of where each structure is located. In the mouth, we have the teeth, tongue, and salivary glands, the esophagus, the stomach, the liver, gallbladder, pancreas, small intestines holding the duodenum, and ileum. Large intestines have the colon and the rectum. In the mouth, we have the tongue, which helps food manipulation, moving the food around in the mouth to ensure thorough mixing with saliva. It also contains taste buds to detect flavors and influence food choices. It shapes chewed food into smaller masses called bolus for easier swallowing. Swallowing initiation, when the food slides to the back of the throat to trigger the swallowing reflex. The teeth mechanically break down, tearing, grinding, and chewing food. Salivary glands, saliva production, anticipating eating triggers the production of saliva from salivary glands. While chewing, food is mixed in this with saliva enzymes. The saliva also lubricates food particles, making the passage through the esophagus, which is the next part of the digestion process. The esophagus is a transportation, a long muscular tube connecting the mouth to the stomach, moves food and liquids through muscular contractions called peristalsis. Moving further down the digestive system, the stomach. A cat's stomach is relatively small in comparison to other species. Once bolus and liquid has reached the stomach, the breakdown of bolus continues chemically and mechanically. We have digestive enzymes, protease, which break down proteins, lipase, which break down fats, also known as lipids, and amylase, breaks down the starch. The partial cells in the stomach lining secrete hydrochloric acid, making the gastric juices highly acidic. After a few hours, bolus is partially preceded by the gastric juices producing a more pulpy-like liquid substance, chyme. Chyme facilitates further breakdown of nutrients, preparing them for absorption in the intestines. Moving on, we have the liver and the gallbladder. The liver is a highly multifunctional organ that produces hormones, proteins, and glucose. It also clears waste products, drugs, and toxins from the blood. In digestion, the liver produces bile, which helps with fat absorption. The bile is released through the gallbladder into the first part of the small intestine, the duodenum. Next, we have the pancreas, a vital organ having two functions, endocrine and exocrine. The endocrine function produces hormones into the bloodstream to control blood sugar levels. The exocrine function produces digestive enzymes such as amylase and lipase, DNAs, and RNAs. Like bile made by the liver, stored and released by the gallbladder, the pancreas releases these enzymes into the duodenum, the first section of the small intestine. The small intestine is broken down into three segments. The duodenum, the first section of the small intestine, plays a crucial role in digestion. Chyme from the stomach is processed here by pancreatic enzymes that break down proteins, sugars, and fats, while bile from the liver aids in fat digestion. The duodenum also begins the absorption of nutrients. Second section is the jejunum, the middle section of the small intestines. It is responsible for the nutrient absorption. Folds in the inner lining of the jejunum, called villi, increase the surface area for absorption. In cats, the jejunum is where most of the digestion of food and absorption of nutrients, such as sugars, amino acids, and fatty acids, occur. The last section is the ileum, the final section of the small intestine, continuing the process of nutrient absorption, specifically vitamin B12, bile salts, and any remaining products that were not absorbed in the jejunum. Peyer's patches, important in detecting harmful bacteria and maintaining gut immunity, are found in the ileum. Next, we have the large intestines, primarily responsible for absorbing water and electrolytes from indigestible food matters, forming solid feces. The colon, the main section of the large intestine that further absorbs water, salts, and some vitamins, and compacts waste into feces. The rectum is the final part of the digestive system, where feces are stored and before expulsion. Now we're going to talk a little bit about nutrient requirements. Nutrient requirements for an adult cat. The American Feed Control officials set requirements for species such as canines and felines. The photograph to the right is an AAFCO fat cat food nutrient profile based on dry matter. Proteins, 26% on a dry matter basis. This is broken down into amino acids. Total fat should be around 9% dry matter basis. Cats cannot synthesize fatty acids, so it is essential to add it to their diets. Many diets will include omega-3 and omega-6. However, the AAFCO does not recognize them as essential. Fiber should be limited to 3 to 5% dry matter, should not exceed the 5% of their daily calorie intake. Vitamins A, B3 niacin, vitamin D, vitamin B1, and vitamin E, as you can see on the chart next to us, what each of their percentages are supposed to be. Minerals, calcium, phosphorus, potassium, sodium chloride, and magnesium, as well as trace minerals, are also found on the chart. Nutrient recommendations for adult felines with urinary tract issues. Providing a preventive diet for your adult cat with a history of urinary problems is crucial to minimize the risk of future complications. Specially formulated diets can help manage mineral levels, reduce crystal formation, and maintain a healthy urinary tract environment. By proactively addressing these issues through dietary management, you can significantly improve your cat's quality of life and reduce the likelihood of painful and potentially life-threatening conditions such as urethritis and urethral obstruction. Important key features for a diet with a cat with urinary tract issues. Moisture. Diets high in moisture are important nutrients in diet maintenance for a cat with urinary tract problems. Proteins. These are essential for tissue repair and maintenance. However, moderate levels are recommended for cats with urinary tract issues. Excessive proteins can increase urine volume and contribute to crystal formation. Total omega-3 fatty acids. The importance of these possess anti-inflammatory properties that can benefit the urinary tract. Fish oils, flax seeds, specific commercial cat foods enriched with omega-3 fatty acids. Magnesium. Importance is it involves various body functions, including the muscles and nerve functions. However, excess magnesium can only contribute to stratutive crystal formation in the urinary tract. You will see common dietary ingredients, proteins such as chicken, bacon, beef liver, bison, and lentils. Fat, flaxseed, canola oil, chicken fat, fish oil. Fibers, gargum, lentils, bananas, barley grass, and carrots. Vitamins, blueberries, broccoli, cranberries, brewer's yeast, oatmeal, vitamin C, vitamin B, and vitamin B5. Minerals, you'll see calcium, chelated minerals. I reviewed 2 studies when reviewing the best diets for Toby. The study 1, comparison of foods with differing nutritional profiles for long-term management of acute, non-obstructive, idiopathic cystitis in cats. The main findings of this study compared the long-term effects of different diets on managing acute, non-obstructive idiopathic cystitis, FIC, in cats. The study found cats with FIC fed diets with differing nutritional profiles experienced varying degrees of symptom relief and reoccurrence. While all diets showed some level of effectiveness, some nutritional modifications, such as increased moisture content and specific dietary additives, appeared to be associated with better long-term outcomes in managing FIC symptoms and preventing reoccurrences. The relevance of this study for owners seeking a better diet for their adult cat with urinary issues, the study directly addressed feline idiopathic cystitis, which is a common urinary issue in cats, especially senior and generic cats. The research highlighted the potential benefit of specific dietary changes, such as increased moisture content and additives like glucosamine, in managing FIC symptoms and preventing reoccurrence. Although this study focuses on FIC, the findings might be applicable to other urinary tract problems commonly seen in older, neutered male cats. The second study, effects of the urinary food supplement with milk protein hydroslate and L-tryptophan on female idiopathic cystitis, results of a case series in 10 cats. The main findings of this study, researchers investigated the effects of the urinary food supplement with milk protein hydroslate and L-tryptophan on feline idiopathic cystitis, FIC, common in feline lower urinary tract disease, with no known underlying cause, often associated with stress. Cats that complete the study showed significant improvement in their signs. This suggested that the supplemented food may positively impact both the physical and emotional aspects of FIC. Cats enjoyed the taste of the food, indicating good palatability, which is crucial for long-term dietary management. This study provided preliminary evidence that a urinary food supplement with MPH and LT may be beneficial with FIC. This study would benefit owners of Toby to explore the potential benefits of specific urinary food supplements, such as probiotics, with ingredients aimed at reducing stress-related behaviors, which often associated with FIC. This study could provide insight into dietary management, the roles of milk protein hydroslate and LT might help manage stress, as the cat's urinary issues may be exacerbated by stress. While this was preliminary, they suggest urinary food supplemented with MPH and LT could improve urinary health and emotional well-being. Comparison of the two studies. Both studies investigated the impact of dietary intervention on feline idiopathic steatitis, a common urinary issue in cats. They both found that certain nutritional changes can be beneficial in managing FIC and other urinary symptoms and preventing reoccurrences. Specifically, both studies highlighted the potential benefits of increased moisture content in the diet, suggesting that wet food or adding water to dry food may be helpful. Additionally, the first study found that specific dietary additives such as glucamine and chondroitin showed promise in managing FIC, while the second study explored the effects of milk protein and LT supplementation. I researched several diets to find which diets I feel might be best for Toby. Diet 1, which is ranked second, is Blue Buffalo Natural Veterinary Diet W plus U Weight Management and Urinary Care, grain-free, dry cat food. The pros to this: low magnesium, 0.10% maximum, helps minimize the risk of urinary crystals, supporting urinary health. Added nutrients, omega-3, omega-6, taurine, and carotene, support overall health, including heart, skin, and weight management. Cons to this: high fiber, at 13% max, could cause digestive issues like bloating or reduced nutrient absorption in some cats. Moderate moisture was 9.0% max, slightly lower than ideal optimum hydration for a cat with a urinary tract infection. As you can see from the diagram next to us, the ingredients are on the back of the bag, and the weights and daily feeding tips are also here as well. Diet 2 was ranked first. It's the ANIM's Proactive Health Adult Urinary Tract Health Dry Cat Food. The pros to this diet are low magnesium, 0.10%, helping to reduce the risk of urinary crystals formation, supporting urinary tract health, and has a higher moisture content of 10% max. Promotes hydration, which is essential for preventing urinary issues in cats. The cons to this diet would be high fat content, 15% minimum, may be too high for less active, overweight senior cats, potentially leading to weight gain and more urinary tract issues. Also has a moderate fiber of 1.7 max, could be too low for cats needing additional digestive support or weight management through fiber increase. Again, you will see the weights and the daily feeding schedule. Diet 3 was also ranked third. Hill's Prescription Diet CD Multi-Care Urinary Care Dry Cat Food. Pros: very low magnesium, 0.04% minimum. Excellent for preventing urinary crystals, making it highly effective for urinary health. The moderate fat at 13% minimum helps with weight management without being too high or too low. The cons to this: it does not have a listed moisture content. Lack of moisture could limit the effectiveness of urinary health unless supplemented with wet food or extra water. It also has a moderate fiber, 1.6% max, may not provide enough fiber for cats needing additional digestive support or weight management. Once again, you see the weights and the daily feeding. Summary of these three diets. Diet 1, Blue Buffalo. This food balances urinary health with weight management, features low magnesium and added nutrients like taurine, omega-3, omega-6 for overall health. However, its high in fiber content may cause digestive issues in some cats, and the moisture level is moderate. Diet 2, ANIM's Proactive Health. This option provides low magnesium, 0.10%, and higher moisture content, promoting urinary tract health through hydration. It also included beneficial nutrients like omega-3, omega-6, though its high fat content may not be ideal for overweight cats. Diet 3 is the Hill's Prescription Diet, With the lowest magnesium content, this option is excellent for preventing urinary crystals and includes terpene for the heart and eye health. However, it lacks the listed moisture content, so extra hydration is essential to support urinary health effectively. I would recommend the ANIM's Proactive Health Adult Urinary Tract Health Cat Food, as it seems to be the best in regards to the nutrients. And it would provide good urinary health, supporting adequate moisture and balance of the nutritional profiles. Moving on to body condition scores. Toby is a 5 out of 9. So Toby's current body condition is considered ideal. This score indicates that he is healthy weight range with visible waistline defined and ribs that are palatable but not overly prominent. His abdominal tuck is evident without excessive fat deposits, which is especially important for neutered senior cats. Maintaining an ideal body weight condition scores is beneficial for minimizing the risk of weight-related health issues, particularly in cats prone to urinary problems. Regular monitoring of his weight, along with the balanced diet and exercise, will help ensure that he stays within the ideal range of his ages. Ideal BCS. Toby's ideal body condition score is 5 out of 9, as indicated. A healthy, balanced weight with visible waistline, palatable ribs, promoting overall well-being. The daily energy requirements is energy requirements that is assigned to animals of different ages, sexes, and whether or not they're neutered or not neutered. Resting energy requirements for Toby would be 251.4 kcals per day. You get this by figuring out a formula. The RER, kcals per day, equals 70 times body weight in kilograms to the 75%. Toby's RER is 70 times 5.5 kilograms to the 75th, which again turns out to be 251.4 kcal per day. His daily energy requirements, estimated daily energy requirement factor for adult male neutered cat is 1.4. So the daily energy requirement minus the resting energy requirements times 1.4. So Toby's DER is 251.4 times 1.4, making his intake 351.96 calories per day. Recommended caloric intake for Toby is calculated calories intake, DER divided by the food calorie kcal per day, using the top recommended diet, ANIM's Proactive Health Adult Urinary Tract Health Dry Food, with 387 kcal per cup. Toby's CCI 351.96, which is 352 divided by 387, equals 0.91 kcal per cup each day. I'd like to thank you for taking time to listen to Toby's requirements and what I feel would be the best for him. As always, you need to speak with your veterinary, hospital, or clinic that you go to, and they can prescribe a food for him. I hope you enjoyed the presentation, and if you have any further questions, please feel free to ask.